Welcome to Extended Families of Nebraska Confidentiality Training. This training meets the requirements for confidentiality and HIPAA training for employees and subcontractors for Extended Families of Nebraska. The purpose of this training is to ensure that all employees and subcontractors of Extended Families of Nebraska are familiar with the Health Insurance Portability and Accountability Act, privacy policies and procedures, and Extended Family of Nebraska's confidentiality policies and procedures regarding protected health information and personal identifying information. Extended Family of Nebraska's employees and subcontractors are expected to maintain confidentiality in sensitive matters in the workplace. As a service provider, we are also expected to follow the Health Insurance Portability and Accountability Act. In order to follow HIPAA, it is essential that employees only discuss customer information on a need-to-know basis. The privacy rule protects protected health information held or transmitted by a covered entity or its business associate in any form, whether electronic, paper, or verbal. Protected health information relates to the individual's past, present, or future physical or mental health conditions and the provision of health care to an individual. Protected health information includes common identifiers such as name, address, date of birth, and social security number. Confidentiality means sharing information only with those individuals who need to know it. This means people who need to know the information in order to perform their job duties. For example, you, as a DSP or SLP, may need to access a person's medical information. Even if someone may need to know the information for their job, they may still need to get a consent or release of information in order to access that information. For example, an outside consulting agency, such as a physician's office, needs to obtain consent before having access to some information. Once a person obtains confidential information, they can only use that information for its intended purpose. For example, if you have access to a person's health information, you cannot share it with the maintenance staff. Confidentiality is very important when working with individuals in a care setting. As an employee or subcontractor, it is important to maintain confidentiality of those you work with. It is not only a question of maintaining professionalism, but an important way to gain trust. Maintaining the confidentiality of the individuals you support is required by law. It helps protect the people you help support. Violations of confidentiality may result in disciplinary action up to and including termination and/or legal action against you. Broadly speaking, confidential information is information that is privileged, classified, or the kind of specific information that must not be disclosed. Some examples you will run into when providing supports to individuals include personal health information. PHI should only be released when assigned consent is present or to those who need to know the information to do their jobs. Financial information about the person and living status. This includes information about who is receiving services from Extended Families of Nebraska. You can ensure an individual's confidentiality is protected in many ways. Many times, confidentiality is violated through carelessness. Do not leave records in public areas. When you are leaving a device that has confidential information, ensure that you lock the device or sign out of the software being used to collect information. Remember that public settings are not the place to carry on confidential discussions. The use of portable electronic storage devices is prohibited. Due to the services provided by Extended Families of Nebraska, we are required to abide by all federal HIPAA regulations and rules. HIPAA, or the Health Insurance Portability and Accountability Act of 1996, is United States legislation that provides data privacy and secure provisions for safeguarding medical information. This gives patients more control of their health information and sets boundaries on the use and release of health records. HIPAA says that protected health information is confidential when it identifies the individual, individuals' relatives, individuals' employers, and individuals' household members. All information about individuals is confidential regardless of format. This includes but is not limited to clinical and billing records, letters and documents, conversations both written and oral, emails, text messages, and voicemail messages. Carelessness or a lack of proper precautions often lead to privacy violations. For example, assuming an auto lock would activate soon, a DSP did not lock her computer. She then left to help a coworker. While waiting, a guardian was looking around and noticed the unlocked computer, looking at the electronic records left open. Not only did the guardian see an individual's prescription for Prozac and a diagnosis of depression, she also read the staff's T-logs regarding the incident that had happened that day with the individual the DSP supports. When leaving any electronic device, it is important to ensure the device is password protected and locked when staff is not present. These are two clear examples of policy violations that could have been prevented by taking precautions. If you observe or suspect a violation of an individual's confidential information or a violation of HIPAA, this should be reported to your supervisor immediately. Now that you have completed the course for maintaining confidentiality with those you will be working with, the final step is to complete the online test. Please click on the link located in the description section. You must receive an 80% to pass. If you do not pass, you will be contacted by your coordinator for additional training instructions.